N-Acetylcysteine, NAC, has antioxidant, anti-inflammatory, and mucolytic properties. It is a modified form of the amino acid L-cysteine and a precursor of glutathione, a powerful antioxidant. Glutathione is composed of 3 amino acids: glutamic acid, cysteine, and glycine. Antioxidants are important for combating oxidative stress. Oxidative stress occurs when there is an imbalance between the production of reactive oxygen species, free radicals, and the body's ability to neutralize them with antioxidants. Free radicals are a byproduct of normal cellular metabolism. Free radicals can also be created through exposure to substances that are toxic or that stress the body's immune system. Free radicals can damage cells and tissues, including brain cells. Oxidative stress has been implicated in various diseases, including neurodegenerative disorders, cardiovascular diseases, and certain types of cancer. Oxidative stress can disrupt brain function and contribute to the development and progression of mental health conditions. By increasing glutathione levels, NAC may help to counteract oxidative stress and protect brain cells from damage. NAC also may regulate glutamate, an excitatory neurotransmitter. The exact mechanisms by which NAC influences the glutamatergic system are still under investigation. There is a theory that neurological and psychiatric conditions are caused by excitotoxicity, or kindling, a pathological process in which excessive stimulation of neurons by excitatory neurotransmitters, such as glutamate, leads to neuronal damage and death. When neurons die, their mitochondria, the energy-producing organelles, malfunction. This leads to increased production of reactive oxygen species, i.e., free radicals. NAC, by replenishing glutathione, is thought to reduce brain cell oxidative damage. NAC has shown promise in treating several psychiatric disorders, schizophrenia. Some studies suggest NAC may reduce negative symptoms, e.g., apathy, social withdrawal, in schizophrenia. Mechanism. Inflammation can impair dopamine neurotransmission. Dopamine imbalance is strongly implicated as contributing to the development of psychosis. NAC has anti-inflammatory properties that may help reduce inflammation in the brain, thereby supporting healthier dopamine function. Bipolar disorder. Research indicates NAC might have benefits in treating depressive episodes in bipolar disorder. Mechanism. Potentially by modulating glutamate neurotransmission and reducing oxidative stress. Glutamate is an excitatory neurotransmitter. It has been proposed that imbalanced glutamate and excitotoxicity play a role in the development and progression of bipolar disorder. Depression. Preliminary studies suggest NAC may have antidepressant effects, particularly when combined with other treatments. Mechanism. May involve increasing levels of glutathione, an important antioxidant, and influencing brain-derived neurotrophic factor, BDNF, a protein crucial for neuronal growth and survival. Studies have shown that individuals with depression often exhibit lower levels of BDNF in their blood and brain tissues. Anxiety disorders. Limited research exists, but some studies suggest NAC may have a role in reducing anxiety symptoms. Mechanism. Potentially through its effects on the GABAergic system, which is involved in regulating anxiety. GABA neurotransmitters are inhibitory as opposed to glutamate receptors, which are excitatory. NAC may influence glutamate receptors, which can in turn affect GABAergic activity. For example, by modulating glutamate receptor function, NAC could potentially reduce excessive glutamate signaling, indirectly promoting a more balanced GABAergic tone. Addiction. NAC has shown some promise in reducing cravings and withdrawal symptoms in individuals with addictions to substances like cocaine, cannabis, and alcohol. Mechanism. May involve modulating dopamine neurotransmission and reducing oxidative stress associated with addiction. Oxidative stress can damage dopaminergic neurons and impair dopamine function. By increasing glutathione levels, NAC helps counteract oxidative stress, protecting dopaminergic neurons and promoting healthier dopamine function. Other conditions. Obsessive-compulsive disorder, OCD. Limited evidence suggests potential benefits as an augmentation therapy. Glutamate may be dysregulated in individuals with OCD. This imbalance can contribute to the heightened anxiety, repetitive thoughts, and compulsive behaviors characteristic of the disorder. NAC can help regulate glutamate levels by reducing excessive glutamate signaling, excitotoxicity. This is achieved through its antioxidant properties and by influencing glutamate receptors. Autism spectrum disorder, ASD. Some studies suggest NAC may improve irritability in children with ASD, again, through regulation of glutamate signaling, potentially improving brain function and reducing irritability. Trichotillomania, hair-pulling disorder, and skin-picking disorder. Evidence suggests potential benefits in reducing these compulsive behaviors as they can be conceptualized as subsets of OCD and anxiety. While promising, research on NAC in psychiatric disorders is still relatively limited. Larger, well-designed clinical trials are necessary to confirm its efficacy. NAC generally has a good safety profile, but side effects like nausea, diarrhea, and stomach upset can occur. Optimal dosage and duration of treatment vary depending on the specific disorder.